Have you ever wondered, are there tips to dissecting the voluminous records oftentimes found in the nursing home record? Do you know the federal OBRA regulations that guide documentation standards in the nursing home environment? Hello, I'm Barbara Levin, and I am so excited to invite you to the most knowledge-packed legal nurse consulting conference. Patricia Iyer and I have been working together to organize exciting national speakers and topics for our 7th virtual Legal Nurse Success Conference. We have spoken with legal nurses nationally and internationally to identify hot topics for you. I'm with Gina D'Angelo, who is one of the LNC Success Conference speakers. Deciphering a nursing home record can be challenging, and she will offer insight on how each document type aids in the proper framing of a case. Gina is an expert in skilled nursing, post-acute senior living, and a dementia nurse consultant. She is president of GD Solutions, LLC, with several years of bedside and leadership in the military, hospital, community, and long-term care senior living settings. Through the American Association of Post-Acute Care Nursing, Gina earned 3 certifications: as a Resident Assessment Coordinator certified, Director of Nursing Services certified, and Quality Assurance Process Improvement certified professional. Welcome, Gina.
Well, thank you. It's great to be here this evening.
Can you share with our audience a few of the highlights that you'll be presenting in our conference?
I sure can. So what the audience participants can hope to gain from this, Barbara, is a much greater comfort level in perusing through voluminous records that you often get from nursing home settings. I have a method that I have used. I've probably at this stage reviewed over 1,000 cases and have testified, on some of them. And it was through that process that I started developing a method and challenging myself to doing an initial review in 5 hours or less using the method that I now use myself. And one of the little tips that I've come up with is really getting clear in my mind what the theme of the case is about so that I know how to start my scavenger hunt.
That sounds fascinating because I can certainly understand what it's like sitting under thousands of pages of medical records and trying to find the nuggets and trying to figure out what direction are you going in.
Correct. And not all attorneys appreciate that just because a nurse does something wrong doesn't necessarily mean that it aligns with a negligent act. So when you're starting out as a legal nurse consultant, it's easy to just point out all the foibles. But what I teach helps to really harness in on what is this case about and where's the bullseye. And that's a technique that I'll be sharing with the group on how to find the heart of the case in the records, which again, I'm excited about, and it works. It's cut down on my time tremendously. And at the same time, I can offer my clients really rich reviews when I have my oral reviews with them.
Fabulous. You're saving time and you're saving money.
Correct.
I understand that you will also be sharing some forms and trying to open the eyes of the attendees on what is necessary to find within the medical records and how to interpret some of those complex forms.
Yes. Again, going back to what is this case about? The forms that you look for and the documentation that you look for in a fall case is very different than a wound case. So there's some similarities and then there's some real differences. A person that has behavioral problems is going to require the eye of a tacit nurse to look at different parts of the chart. So what I'll do for your audience is kind of lay out those common types of cases and the forms that you might request or look for, again, to cut down on your time in review. It is not necessary to review every single page in the record. And it is certainly not necessary to read from the beginning of the novel all the way to the end, but rather have a pointed exploratory approach, which again, I'll cover during the course, which I'm very excited to teach, by the way.
And we're excited to have you.
Oh, thank you.
If you want to learn tips and tricks on how to decipher the nursing home record and more than that, this conference is for you. Please join our LNC Success Conference, March 23, 24, 25, 2023. See our link below, lnc.tips/March 2023 virtual. We look forward to seeing you.
Thank you.